You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and
Nurse Anthony.
Yes, sir. Yes, sir. We are on episode 5. Man,
let's go.
We getting close, man.
I know. I'm excited, man.
And once we get to 10 episodes, we'll start releasing one a week. And then we'll see the feedback. And then we'll improve for season 2 pretty much.
Yeah, cool. I have a question.
Yeah. So
I know you just started your new position.
Yeah.
For those of you, we're going to be a little behind, but it's currently Nurses Week right now.
Yeah, it's
I want to know, have you got anything yet?
So no pizzas yet.
Hey, let's go.
Today's Wednesday, May 8th. No pizzas yet, surprisingly. I'm thinking they're saving that for like Saturday or Sunday.
Oh, hell yeah.
But
they're saving it for something.
They're saving it for like a Friday, Saturday, Sunday, I believe. But on the Monday that I worked in the hospital, I think in the morning time, my manager was like, "Hey, Junior, we got bagels and yogurt," which is nice. That I don't mind. Pretty healthy stuff. Yogurt, bagels, orange juice.
Damn, y'all
like
living,
that.
bro.
Yeah, it's not bad. And then our manager also told us that we can go down to the coffee shop. It's called Big B's. It's out in Detroit. One free drink. Damn. Unfortunately, you know me. I told him, yes, supersize me. Like, give me the largest drink that y'all got. You feel me? I think I got like a strawberry shortcake smoothie. I'm like, yo, supersize me, shawty. And she's like, if I supersize you, you gotta pay $1.55. I'm like, no.
Bring that back.
Yeah, rewind. Lower that back down.
Yeah.
Give me a small. So that's as much as I got. And then at the other position, I also work at a surgical center. They were pretty cool. They gave me like a notebook, a few pens, or I don't know. I don't even know if that was part of Nurses Week or maybe it was just my welcome package.
Right,
you know what I mean? So,
right.
But regardless, they got us Chipotle.
Hey,
one day. The other day, what did they give us the other day? They got us some meal from the States, which was pretty good.
That's all right, bro.
How about you?
Honestly, bro, I haven't been back to work. I haven't been to work in a few days.
Okay.
So since before Nurses Week. I was this past weekend.
Okay.
I don't know if I want to know what's waiting for me. It's a 4-day-old pizza.
Yeah. Crusted up.
I don't want to know.
Stale.
Bro. All I know is if I see that damn tumbler again this year, we gonna have some problems.
For sure. But an event that actually happened at work, because I worked in the ICU on Monday at the hospital, we had a bomb threat. Man,
y'all are living a different life over there, bro.
It's the wild west out there, for real. Like, so I'm in my patient's room. We're starting like, I think I'm in my patient's room.
This guy said a bomb threat,
and I got an admission. I'm shadowing, so I'm with a nurse. We got an admission, and his blood pressure is tanking at this point, so we had to put him on a pressor. This pressor is called Levofed, helped to bring up his blood pressure. Nevertheless, he only had one IV. The ER nurse brought him to the ICU with one IV, and this guy's crashing.
Yeah.
He has an A-line.
Yeah.
An A-line, that goes in the artery, and essentially with the A-line, it helps to give you a more accurate reading of a patient's blood pressure.
Right.
So she's saying the A-line ain't working. We're like, all right, whatever. Listen, just bring the patient up and we'll figure it out. But she's so focused on telling us about this sacral wound that he has. We're like, man, honestly, fuck the sacral wound.
Hold on. So he's got the A-line, and then he's got one
peripheral IV,
right?
Like an AC.
Okay.
Barely secured at this point.
And a coccyx wound.
and that Cox is like a stage 3 or some shit like that.
Right.
And she's more focused on the sacral wound. Oh yeah, I dressed it. It has a foul smell. All right, fuck all that. What's his blood pressure right now?
Right.
Oh, the blood pressure is 80 over. Nah, bring him up ASAP.
See, you're better than me. You know what I say?
What?
You'll keep his ass down there until you get another IV site, or you can stabilize him on the way up. You can come up with him.
The thing is,
help me do this admission when you come up here too.
The thing is that in the ER they're so understaffed, and they just have so many patients coming in and out. It's hectic for them. So I can't even blame her, but at the same time, do better. You know what I mean? So they bring up my patient up, and we actually set up the A line to the monitor, and it's working fine.
Just fine. Okay.
So I don't know what the hell she was talking about, how it's not working. Now the blood pressure is low, so that's why I mentioned that we had to put him on a presser, Levofed. So the problem is with Levofed, you don't really want to infuse that through a peripheral. It's going to cause damage into that vein.
Right.
So that's why you need something like a central line. So that's what the physician was working on. The resident was working on the central line, and I think they're called the fellow, which is like a step higher. So while she's doing that, the fellow gets like a page or a call, answers the phone, and he's like, "What? Are you serious? All right, let me call you back." Then he looks at us and he's like, "There's a bomb threat." And we're all like, "Yo," and they didn't even notify us. Like, no,
nothing overhead.
I don't know what is that, like a code? That's not a code black. It is code, a code black, I think.
Yeah, something.
It's a code something.
There ain't no code for a bomb threat.
I'm telling you, man. So you would think that they would like ring an alarm or something, or call. And
but they can't call that overhead either.
Oh no, that would freak out everybody. This is day shift, by the way.
Right.
So yeah, the whole place would freak out. But nevertheless, I think about an hour and 30 minutes later, they mentioned that everything's all clear. But still, and this ain't the first rodeo with bomb threats. Apparently, there was a situation maybe a couple months back where a package came to the hospital. And that was considered,
hell no.
Man, I'm telling you, some Mission Impossible type shit.
Bro, that's a different world. And the problem with me is I'm so unserious, bro. If this fellow took a call, hangs up and said, "There's a bomb threat," I just start laughing, bro.
That's what we pretty much did, because we were laughing at the fact that we weren't even notified as staff.
Bro, could you imagine I got the tourniquet on the patient's arm? This guy says bomb threat as I'm trying to start an IV line. Bro, I would just start laughing, bro.
Man, thankfully our patient was intubated, so he was completely out of it. But yeah, that's one event that happened.
Crazy,
man.
Bro.
It's always something at that hospital. Always something in Detroit, Michigan, honestly.
Sure.
But that's what makes you stronger and better when it comes down to nursing and healthcare, especially out there.
Definitely makes you cautious.
Yeah, if you can work there, you can work anywhere. So
I could agree.
That's how I look at it. So I think I had told you about that other situation.
Mm-hmm. Yeah, you hit me up about this.
Yeah, I sent you the link in the article. So I got some details about it. For y'all that don't know, there was a shooting that happened at Sinai Grace Hospital, which is in Michigan as well too. So based on what I understand, there was a patient, and I might be wrong about this, but he was in the ICU and he had a gun on him. Yeah, he had a pistol on him. Pulled that thing out. I don't know what the nurse said to him.
Hold on, this is a patient.
This is a patient.
Oh my goodness.
Oh, you didn't read the article.
Oh my goodness.
This is a patient. 2 days after he was admitted. So this patient was brought from wherever. EMS. So they brought him in through ambulance.
See, I read the headline and the first little bit, and I'm like, bro, motherfuckers are trying to kill a patient.
The article didn't really have the nitty gritty details, you know. So I kind of talked to some of my colleagues in the hospital, and they kind of gave me some more information on top of it.
Right.
So this patient came through the ER with the ambulance.
Okay.
And essentially when you come through the ER with the ambulance, you bypass security and you also bypass the metal detector. Yeah,
I see.
because you're in a critical state, I guess. So
Yeah, they just kind of got to start
they
working
they
on it.
just gotta stabilize you at that point. So that's
Right.
what they did. So they bypassed all of that. From there, maybe they were stabilizing them. They stabilized them, but they didn't go through his belongings. Typically in the ER, they don't really do that. It's not really their, I guess their job per se.
Okay.
And plus you need consent from the patient,
Okay.
if I'm not mistaken, for the most part. You can't just go through someone's belongings without asking them, hey, sir, ma'am, can I go through your belongings?
Right.
I think some hospitals and facilities have protocols for that, at least to my knowledge. Anyways, they stabilized them. Doctor eventually said, we're going to send them to the ICU. Now, upon sending them to the ICU, it's now that next nurse's job to go through the belongings and make sure, there's no deadly weapons. Make sure you count for personal belongings that are valuable, whether it's money, a ring, dime, whatever.
Right.
My understanding is maybe they didn't do that, because if they did do that, they would have noticed that he had a gun on him or something like that.
Yeah, I feel like that's so tricky. So just to cut you off real quick, because when I have a patient that comes up, a new admit, it just depends. Like, I can't sit here and say I always go through their stuff. I think that has to do with a lot of things for me. I don't want something to go missing and then they think, that big black guy over there was going through my stuff. And I'm just like, nah, nigga, put that shit away.
Yeah.
I don't want nothing to do with this.
So at your facility, y'all don't have like those belonging sheets?
Okay, so we
or
do.
Personal belongings?
So when we admit someone, that's on the computer. So let's say they come up, you have your bags on the bed or something, or the porter puts it in the closet. I'll take a peek at it. I see some clothes. I see this. I see that. But I'm not really going through people's stuff.
Right.
Yeah, I just don't need. And bro, things go missing all the time.
And that's where the checking comes into play, where you actually go through the belongings with that patient,
Right,
to make sure. Oh, sir, so I'm counting that you have $100 on you.
right.
Do you agree? Yeah. All right. We're gonna sign off on that.
Sure.
You're gonna sign off on that. It takes time, but it's got to be done. It's at the facilities that I worked at.
Right, and that's another thing. Like, I usually, at least on our unit, we don't have that time factor.
Oh.
I just can't. But however, what happens if, let's say, I go through the bag and I find a handgun? What the fuck am I gonna do with that?
You gotta call 911, my boy.
What are you doing, bro?
You gotta call
See, and this
911.
is again where I'm unserious, bro. I just start laughing and I'm like, "What are you doing with this?"
Yeah, like,
You know what I'm saying?
You're in here with a heart failure. What the hell? You got a handgun on you?
You know, like, I'm too unserious, bro.
Nah, I'm the same way, honestly. I've had situations where I've had patients in the past. The ones that I've admitted, they came in with like meth, cocaine.
Right.
I've seen a gun before as well too. Knives. Here's a crazy one, an axe. I had a patient that had an axe.
Yeah.
This was in Alaska.
You know what? If I was to guess, bro,
That would have been the one?
be my first guess.
Yo.
You know?
Yeah, this guy had an axe. I'm like, yo, sir, what are you
Right
doing?
there. Niggas don't go through Detroit with no axe, bro.
Nah, not at all, man. But that guy, he was just intoxicated. He couldn't even give me a straight answer.
Okay, so
Right. Let me go
so
back.
no one went through his stuff.
No, my understanding is no one went through his stuff. So
Okay.
essentially, he was admitted for pneumonia-like symptoms.
Okay. To the ICU?
To the ICU.
Okay.
So I'm assuming he had some breathing issues where they had to stabilize him, give him breathing treatments, et cetera, et cetera. They admitted him to the ICU for more focus and attention. And 2 days go by, and that's when the incident happened, where I don't know if the nurse said something to him to the point where he was just agitated, pulled out a gun, shot at the nurse.
Holy shit.
Missed. The first bullet went straight into the computer screen.
That's crazy.
As soon as that
bro.
shot went off, everybody scattered into like the manager's office and like to the nearest room that needed like a badge entry, because in the hospital you have like a badge and you scan and it opens. If you don't have a badge, you can't get in.
Right.
So this guy shot, missed, hit the computer screen. Everybody scattered. Second shot went off, and then for a couple minutes they didn't hear anything else. Now they go back into
crazy, bro.
It's nuts. So now they go back into the room and this guy's on the floor. He had shot himself.
Oh my God.
Now, in this situation, as a nurse on duty, it's your scope of practice and it's your, you know what I mean? You got to resuscitate this man. So now I just got shot at and now I got to resuscitate this man.
That's crazy.
I got to bring him back to life, which they did. Unfortunately, no movement, essentially brain dead.
Okay.
Now, based on what some of my colleagues told me in the notes, they said that he had a mental health history.
100%. That's
So my thing with this is, if you're the physician in the ER, and I'm not blaming anybody, but typically, or even the nurse, you got to go through the notes and say, okay, this guy has a mental health history. He's been here in the past for different issues relating to mental health. Maybe we should search his belongings and make sure like he has no weapons on him. And
right. To be fair, I will say that is the only time I do go through my patient's belongings. If they have a psych history, and a mental health history,
Yep.
I will 100%. I got to go through your belongings.
For sure.
And so that's what I should have been more specific. Almost every time I find something, bro.
Definitely.
And usually it is drugs or like a pocket knife or something I shouldn't say unserious. It's still serious and I got to take it away. But I always, if you have a mental health history, I have to. And it's not even, yes, of course, it's the staff, but for their own well-being as well,
Yeah. For the staff and for other individuals that are there visiting their families.
Absolutely.
Right? I can only imagine if there's other patients, family members there at that moment when the shot went off.
That would have been terrifying.
But yeah, 2 shots went off, so I heard. And that second one, he,
committed suicide.
Shot himself or attempted to commit suicide. Now he's just, brain dead. I don't know if he passed away or, if they're still continuing care. It's unknown to me. But nevertheless, that was a situation that happened at work. So now I guarantee you, moving forward, they're going to have an in-service where if a patient comes through the ER by ambulance or EMT, the ER nurse must, or somebody within the ER must go through the belongings. They're going to implement that ASAP.
100%.
Then when they get to the next floor that they get admitted to, same thing again.
100%.
So that's what's going to happen.
I'd be surprised, though, especially in the U.S., if that's not already in place. Like, I'm sure let's say they have a debrief. I'm sure they're going to say there was a mistake made. Policy was broken somewhere,
and someone's going to get in trouble for that, honestly.
Absolutely.
But at the same time, that's where it comes down to burnout, right? A lot of nurses right now are burnt out. They're tired. I know a lot of nurses are working back to backs. You know what I mean? So
100%.
I mean, and in the ICU it gets busy, just like in the ER.
For sure.
It gets super busy. So I mean, if you in the ICU, the ratio is usually 1 to 2, so 1 nurse to 2 patients. So I mean, usually most of the patients in the ICU are typically stable to unstable to the point where you're chasing IV drips.
For sure.
Whether it's like propofol, the propofol's running out, I need to go handle that before my patient wakes up and starts pulling on his tubes, lines, stuff, and now I'm deeper in the shits. Absolutely. You know what I mean? So, absolutely. So I mean, I don't know the situation that day, but who knows? I'm not blaming anybody, but I mean that's just a situation. I can only imagine that they're probably short staffed, so where she just didn't have enough time to go through the belongings.
I feel like, and maybe I shouldn't take it here, but I feel like anytime these things happen, the nurses take the brunt of it.
Oh, 100%.
And all I can think to myself is, bro, I just feel like we deserve a better wage, bro. I just feel like
a life could have been lost. You know what I mean?
I mean, life was lost. Like,
yeah,
for all
at
intents
this
and
point,
purposes,
probably.
you know what I'm saying? Like,
Yeah.
I mean, we're just lucky the nurse didn't get got
hurt.
too. You know what I'm saying?
And you know what's crazy as well too? A nurse just got shot at, and she witnessed that, and her staff,
Right.
her colleagues witnessed that.
Right.
I guarantee you, they went back to work the next day.
The next day, they found him unresponsive. They went back to work 5 minutes later.
You're right. They went right back into it.
And truthfully, and that's kind of part of the story that baffles me, man. And here's the thing, like, I wouldn't say that I'm the type of person that gets traumatized easy, but somebody's shooting at me.
Oh my gosh.
I cannot sit here and say undeniably I'm running a code right there for this person that just shot at me. I can't. I just feel like that's where I feel like I would get too traumatized by that.
Oh,
bro.
for sure.
That would fuck me up a little bit.
For me, I mean, shit. I'm gonna be honest. I'm going home. I'm out of here.
I'm out, bro.
Like
I got kids and I was just shot at.
Yeah.
See ya.
Like I just like this is a sign.
Yo, that's God.
It's God telling me,
100%.
my boy, you need to go home and shake it off.
This ain't your day, my boy.
Yeah.
That's what he's saying to me. I'm telling you right now, bro.
But I think, and I think that's the norm these days, where as nurses, a traumatic event happens to us or to someone else, and the higher ups, administration expects us to go right back to work.
Right.
They don't send any resources to say, hey,
Nothing.
is there anything we can help you with? Do you need somebody to talk to? Do you need a break? Take a week off with pay. Nah, there's none of that.
No, I'll tell you what there is, bro. There's Nurses Week, and we get some pizza, and they say, y'all
Get some pens
and y'all will be all right. That's crazy.
Lanyards,
bro.
all that shit.
Holy.
But yeah.
This is where, again, I feel like I agree with you. It's in part burnout. It's in part doing too much. It's in part like not enough pay because, and this reminds me of a story. This is a little bit pre-pandemic. I guess the event was pre-pandemic, but the outcome was post-pandemic, I guess. It was a nurse in Tennessee who, I guess, from my understanding of the article, she had a patient that came in with like lowered level of consciousness. Anyways, they stabilized the patient. She was okay. Level of consciousness was improving. They were on the way to discharging the patient, but before, I think they had to do like a repeat MRI or CT or something. It must have been an MRI. And the patient was just uneasy about the whole thing. So I guess to get her to like calm down and just kind of settle her anxiety, there was an order put in for Versed. Okay. So accidentally, I guess the nurse, instead of giving Versed, she gave some sort of paralytic that starts with a V as well.
Oh, I think I did hear about this story. This happened a couple years ago.
Yes.
I do remember this.
And unfortunately, the patient became brain dead and obviously passed away.
My God.
So this event, like I said, happened a few years ago, but then last year, from my understanding, the nurse was charged with criminal negligence. Now, there are some nuances to the story where I guess the hospital, so like the machine, I don't know what you guys call like the med machine that you deal with. For us, it's called a Pyxis.
Yeah, so there's a Pyxis. There's another version of it called the Omnicell.
Right. I've heard Pyxis as well, like that we had overseas as well. Mm-hmm. They're all the same thing.
Yeah.
So because I deal with Pyxis, I'll call it a Pyxis machine.
Got you.
So I guess their Pyxis machine was already giving issues. And there were some other problems regarding, like, let's say if I'm going to pull out the wrong medication for a patient,
right, I'll
get like an alert like, hey, are you sure? Does this patient this? Blah, 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 blah. I guess these alerts may not have popped up to prompt her like, hey, this is the wrong medication.
Makes you wonder why.
Yeah, so I guess, like I said, she was charged with criminal negligence. She could be serving some jail time. How much? I don't know. My point of all this is like this sets a precedent for other nurses. Like, you cannot make any mistakes.
Yeah.
Now, don't get me wrong. This is a big fucking mistake.
It's a big one.
This is where, and I mean, in other episodes we've talked about, you need to know your meds.
Yes, we did talk about that.
You know what I'm saying? And this is where you need to see what you're pulling out, because there's a big difference between a Versed and a paralytic.
And that's the thing with like a paralytic, with both of them, I would imagine that you would need to have a cosign, right? Because I know in some facilities, if you're giving a narcotic or even a paralytic, once you scan that, and mind you, I know there are some nurses that don't necessarily scan their meds. And for the new grads, don't do this. Some nurses will pull out the med, go into the patient's room and just give it and save the the vial or the plastic part of it, put it in their pocket and then scan it after because they're so busy. Yeah, don't do that.
Or you just like on our system, you can just like click it off.
Oh, right.
Of,
Yeah, you can right click it and be like unable to give,
unable to scan,
and then it prompts a reasoning that you got to give back as to why. And then most people would be like, oh, the barcode isn't working. Or something of that sort.
Right.
So,
I think actually happened in this situation. I think it was just one of those, she was in a rush. Here's your medication.
And that's what I'm thinking. That's probably what it could have been. Or, maybe it was just fatigue. Was it shift 7, or was it shift 15 in a row? Who knows? Because this is during the pandemic, you were saying, right?
Yeah, it was a few years ago.
Yeah, so I'm thinking it's around the pandemic. She must have been working multiple shifts, maybe. The second thing is, were they short-staffed? Did she have enough support on the unit? How many patients did she have? Is this a med surge?
No, I can't remember.
Now,
but if she had lower level of consciousness, probably like a neuro floor.
So, okay.
I would assume.
Yeah, so if it's an ICU, ratio, like I said, is 1 to 2, 1 nurse, 2 patients. Or if it's step down, you may have 3 to 4. It all depends. There's so many things that can go into this. But yeah, it's just unfortunate, man. So yeah, that's unfortunate, man. Unfortunate for that nurse.
Yeah, so my thing is, if that's the case, right, and they already had problems with their Pyxis machine, their med machine, med cart, whatever, do you feel like the hospital takes ownership for part of that too?
100%. You can't put everything on the nurse. Because it seems like from the first day of nursing, whoever established the profession nursing, it seems like we always take the heat.
Yeah.
So with that being said, the hospital definitely has to take some accountability on it too. It can't be 100% on the nurse.
Right.
And in one episode, like we mentioned, this is why they're getting paid the big bucks, right? They have to essentially use their knowledge upstairs and determine, all right, what are certain scenarios that may happen on the floors,
right?
And how can we prevent that from happening? What can we do to make sure that these nurses are supported mentally, emotionally, et cetera, et cetera?
Right.
Now, like I mentioned, it might have been short-staffed. All right. If you're short-staffed, now it's up to management and administration to find a nurse to support these nurses that are there. Because you can't have 2. I've seen situations where it's 2 nurses and like 10 to 15 patients.
Oh, crazy.
Insane.
Bro. Crazy.
And you can only imagine nursing homes, what they're dealing with.
Bro, crazy. So that's kind of what like my next question becomes too, is that how do we stop these things from happening? Like, let's say this is just a regular neuro floor, no ICU, right? Because like I said, as far as I could tell from the article, this patient was on her way to discharge. Do we have better patient ratios? Like, what's the solution?
It's tough, and this is the thing. I'm sure solutions and ideas have been brought up, but they just haven't been not addressed, but they just haven't been focused on and implemented yet. Sure. And the reason behind that is why? The dollar, the money.
It ain't there.
The money on it. No, it's there.
That's what was actually what I was say. It is there.
It's there. They
it's
just
absolutely there.
They don't want to spend it because now it's coming out of their pocket.
Right.
You know what I mean? So it all comes down to money. And these hospitals are making not millions, billions. Goodness. And that's with a big B. They're making billions.
Big old B.
And big bank.
You know?
So I think that's what it comes down to. So as nurses, I've seen nurses go to the extreme.
Yeah.
We need support in this. We need help in this. We need more nurses. We need more resources. And what happens? Management just shoves it under the rug.
Which is crazy to me because in most hospitals, at least hospitals, I can only speak for a hospital setting. In most hospitals, let's say you have like your ops manager, you have your clinical practice manager, you have your educator and all these things. These people are all nurses.
Yeah.
And I find there's so much pushback from these people. Now, I understand they have bosses that probably are not.
Right. But like the high up.
Yeah. Right. But because you are a nurse, you should understand where I'm coming from. And a lot of the time, at least from my examples, we have some issues that need to be addressed. And I find they just get pushed under the rug primarily by our nursing management that you would think would have our backs.
And I don't necessarily think they're the ones pushing it under the rug. Like I said, it's the ones above them. Because at the end of the day, our managers have to answer to somebody.
Sure.
So, we can tell our manager, hey, we need help on this, that. And you may have a manager that totally agrees with you. All right, now she goes up or he goes up to the next level to someone who isn't in nursing and can't really comprehend what they're trying to explain because they're not in healthcare. They're just a business person.
Sure.
And they'll be like, nah, just, delegate it to someone else. Have them delegate it to someone else. Well, in reality, who can they delegate it to? They're short-staffed. Have them figure it out, but we're not gonna spend the bucks.
That's fucking crazy, bro.
And that's what it comes down to. That's what I think is going on.
That's definitely what's going on.
Because once they spend money, it's coming out of their wage.
Right.
You know what I mean? And I guess it always comes down to a quota, right? They always got to meet a certain quota, and that's what it's just the money, man.
Yeah.
Money. They man, and they're making well over 6 figures, and they're just in an office. Hell, they probably aren't even in the facility most of the time.
100%.
They're probably at home.
Absolutely.
They're probably in Dubai.
They got their Zoom calls. You know what I'm saying? No, absolutely.
So that's what it is. But I mean, at this point, if they don't make a change in that, in that motion, we're gonna continue to have a lot of these errors and issues continuing on.
See, which is where I'm kind of surprised in Canada there isn't more pushback. Now, I know that the U.S. is primarily private, if not all private. So because everything is private sector, it's hard to, I guess, interpret people's wages for the most part. In Canada, we're public sector, though. So everything is online. And every year we see a sunshine list.
Right.
And these hospital administrators, we know exactly how much they're making on paper. I don't know what they're making beyond that. But on paper, we can see what they're making. And these numbers are crazy. Insane. Now, I'm not sitting here saying that the person running the hospital should be making as much money as I am. That's not what I'm saying at all. However, man, if you're making 6-7 figures at times, we need some more action from you, my man. Like, we need something else.
100%.
You know what I'm saying? And now, do I have the answers? Absolutely not. But I'm not the one getting paid 7 figures. You give me 7 figures, I'm gonna find some solution to some problems.
100%.
You got problems, I got solutions for 7 figures. You understand?
Big time, big facts. And I've seen a lot of nurses in situations like you're explaining where they go above the manager and try and talk to administration. You know what they do? They fire that individual.
100%.
Yeah, she's too mouthy. He's too mouthy.
Right.
We don't need that.
Like they get made an example out of.
Yeah.
Absolutely.
To the point where they're trying to put fear in the other staff.
Absolutely.
Okay, yeah. What she did, y'all better not do that or else y'all are next and y'all gonna get cut
Or
off.
then they say, oh, well, this is proper protocol. This is how you're supposed to do this. Well, we've tried doing this. It ain't working.
And it's failed.
Right.
Multiple times.
Right.
So what's next?
You got patients shooting up nurses.
Yo, insane. I really
Bro,
want
that's crazy.
I really want to see what they do moving forward because that's a huge safety concern.
Absolutely.
Not just for patients, but for family and
that situation could have gotten so much worse. Oh my goodness.
Now imagine if that patient were to be able to make his way up to the administration office.
Oh my God.
I guarantee you there'd be a change.
Oh, absolutely. Right here, sir. You follow the arrows. That's where you go.
Take that elevator up to the 5th floor. Here, take my badge, by the way.
Yeah. You want to implement some changes?
Yeah. Talk to the CEO.
That's crazy, bro.
Big
I
time.
can't believe that happened.
Yeah, it's sad. It's sad. But it's nursing. It's nursing. See stories like this all the time. But yeah, man, it's just crazy. But other than that, I mean, work was fine. You know, work was fine. It was a good 12-hour shift.
Yeah, I mean, there was a bomb threat. You know, computer got shot up.
Yeah,
you know, it was just
got a free strawberry cheese shortcake smoothie for the free ski.
Bro, that's crazy, bro.
Yeah,
y'all deserve a nursing month over there.
Nursing month, man. Nursing year.
Like, and I think that's just crazy, bro. Oh my goodness, that's your first day.
That's my first day, and
I can't wait for more stories, bro.
Me too, man. Me too. I have plenty of stories. So, let me think of this one situation. So, I also work at a surgical center right now, pre-op, post-op. So, for most of y'all that don't know, let's say you need to go have surgery done on your knee or whatever the case may be. You'll come, either it may be a surgical center or maybe the hospital. You'll come in, I'll check you in. We'll confirm that, all right, we're doing the left knee. We'll sign that left knee to make sure that, that's the correct site. From there, handle consent, start an IV, start fluids, and get you ready for surgery. Then they roll you in, they bring you out. You're still loopy from the anesthesia. But then once that wears off, the pain starts to kick in, right?
Right.
And then from there, we give you fentanyl, Dilaudid, whatever the case may be. Anyways, the reason why I'm mentioning this is in the past, I've had situations where patients, and this is in Detroit when I used to work in a pre-op PACU, I would have patients that would say, and mind you, they come out of surgery and they're like, yeah, nurse, I'm in pain. Like that Peter Griffey, you know what I'm saying? I'm like, all right, listen, what's your pain at? It's a 10. All right, believable. Okay. All right, so what I'm going to give you, this, and the doctor usually has like a set medication list. Within it, it'll either be fentanyl, Dilaudid, whatever the case may be, usually those two. Now, I had this one patient that told me, no, fentanyl doesn't work and Dilaudid doesn't work. I'm like, excuse me? Yeah, fentanyl doesn't work and Dilaudid doesn't work.
What they ask for, bro?
Interesting. So what works for you then? He's like, I need a perk 30. I'm like, you got to be out your damn mind. First and foremost.
Oh, he is out of. He's about to be out of his fucking mind.
At this point, he probably is.
100%.
It's still the anesthesia.
That's fucking crazy.
I'm like,
bro.
You need a perk 30. He goes, yeah, perk 30s work for me. I'm like, there's no way in hell, because a perk, it's a tablet, man.
That's crazy.
It's gonna take like at least 30 minutes for it to kick in. You gotta swallow it. It'll go through the digestive tract, hit the stomach, the acid. You're not even gonna absorb, the whole thing realistically.
Yeah.
You'll get like a fraction of that medication working. But as opposed to us giving you Dilaudid or fentanyl through your IV, and it hits the system right off the bat.
Immediately, bro.
So this guy, it's the anesthesia talking, because hell no, I ain't giving you no perk 30.
Bro, I've never heard anyone say, fentanyl doesn't work for me.
I need a perk 30.
That's crazy. Yo.
He's a fiend, man.
He's an expert. We'll call him an expert.
Man, some of these patients, they know their pain meds,
bro.
Like even with Dilaudid, like, some people are opioid abusers, right?
Yeah, absolutely.
So some medications, you don't really want to give it to them because they'll be hooked like phonics, man.
Oh, bro.
So now the doctor will prescribe fentanyl or something, like Toradol, I think is another one. But when it comes down to it, you'll have patients that are like, oh, no, that doesn't work for me. I need that one that starts with a D. What's the name? Starts with a D. Dilaudid, yeah, that's the one.
That's the one. That's the one.
It's like,
okay. When they hit you with that Tyrone Big B scratch, holy,
they're on some bullshit timing at that point.
You just know what's coming, bro.
Yeah, so I mean, it's one of those ones where, I need Dilaudid. That's the one. Can you talk to an anesthesiologist for me and tell him or her to prescribe that, because these ones don't work. Yeah, don't worry. I'll tell them. I'll walk a lap. I'm not even gonna go to their office. I'm just gonna walk up. Yeah.
He said no.
Because at the end of the day, we've already discussed this, me and the anesthesiologist, prior to them going to the procedure. We read the notes. We know your routine.
Absolutely.
So I'm not going into the office because he already told me what he wants, and he's not changing his mind.
Absolutely.
So I make a lab, come back. Yeah, unfortunately, you can't have that medication. The medication that he ordered, that's what you're getting. So that's what it comes down to.
Never heard no fentanyl, no Dilaudid. I've heard. I know that there are a lot of side effects to Dilaudid, but when you're in pain, no fentanyl.
And a lot of people are kind of skeptical of fentanyl. I'm not sure if you've heard of rainbow fentanyl.
Never.
It's like a remix to it. Like I got to do more research on it. I don't want to give y'all the wrong information, but if you Google rainbow fentanyl, that's one of those medications where it's more potent and stronger than regular fentanyl. It's like a street version of it. Yeah. I guess they mix it with like other substances. Okay. You know what I mean? And the reason why I learned about or came to learn about rainbow fentanyl was an article that I read. I'll send it to you. There was a daycare in New York City where
Jesus Christ.
Yeah, this
is already crazy stuff.
There was a daycare in New York City, if I'm not mistaken, where they were trapping and selling rainbow fentanyl from the daycare. A whole investigation happened to the point where it got shut down, and the two owners, the ones that were actually looking after the kids, got sent to prison.
Oh, for sure.
Oh man, it's insane. Rainbow fentanyl is a dangerous thing. It's sweeping the nation. It's slowly sweeping the nation.
Bro, that is crazy, bro.
Yeah.
How do you have that close to these kids?
Honestly, I'm gonna be honest with you. It's a pretty smart. If you're a criminal, that's pretty smart.
Absolutely.
Who's really going to do an investigation or search or think that you're trapping or selling drugs in a daycare?
Absolutely.
But yeah, nuts. There is also another story with the daycare, just for fun. Melatonin.
Oh my God.
Gummy melatonin. So another facility, daycare facility where this parent would pick up his child after work.
Just be sleeping
around like 5 p.m. Right, he picks him up, kid's sleeping.
Crazy.
Now 9 or 8 p.m. hits, this kid's wide awake.
Oh no,
bouncy, like just energetic.
Oh yeah.
And the dad's like, "Yo, what the hell's going on? This has been happening for the past 4 or 5 weeks."
Yeah.
And what does he do? He puts a camera on the backpack.
Oh no.
Yeah, because he's not getting answers. He like the daycare's not really telling him shit. Puts it on the backpack. Now the kid sends his kid to daycare, drops him off, goes home. The situation's still happening constantly.
Yeah.
Now he remembers, yo, I put a camera. Let me watch the film. Watches the film. He sees that the daycare people or the daycare staff is giving every single kid melatonin gummies.
Holy shit.
A high dosage. You get a melatonin gummy. You get a melatonin gummy.
Oprah was running that bitch.
Running that shit, man.
That's crazy.
So these kids are chewing the goddamn melatonin gummies.
That's fucking crazy.
And they knock out throughout the whole day while under the care of these daycare staff. Yeah.
That's crazy.
To the point when the parents come to pick them up, they start to wake up and now they're just up all night.
That's crazy.
They shut that shit down quick.
100%.
Yeah, it's crazy. So if you have kids that are going to daycare, hey, be extra vigilant on what's going on.
You know what though? I think about my son. Bro, that nigga's a different breed. Like, yo, he would eat that shit and pretend like that wouldn't affect him, bro.
Oh my God.
It would not affect him now. Listen, I've never given my son melatonin, but I don't need to. That nigga would eat it and just be like, "What's next?"
he'll bite that in.
Bro, it's late right now. I bet you that he's awake.
He's still up,
bro. Bro, they probably do give them kids melatonin at this daycare.
Man, they immune to it.
That's crazy,
They
bro.
immune to it,
bro.
But yeah, that daycare, I'm sure they're giving these kids like 3 each.
God, bro,
3
that's
each
crazy.
probably. Yeah, it was maybe. They shut down that facility.
Oh,
quick.
for sure.
Yeah,
it's
man.
gone.
Insane.
Jesus Christ, man. You know you want to counteract? No, not counteract, I guess. But I was going to make a joke about the rainbow fentanyl. But we'll keep that shit. Oh, man. So, but that's crazy, though. These people are doing that around kids.
Yeah. I mean, they're just looking for a quick buck, an easy quick buck.
Yeah.
You know, they don't want to put that much effort into it. And I get it. Some of these kids are rowdy and it's just insane.
Bro, but then why do the job?
Why do the job? Exactly.
You know?
And now this makes me think and takes us into the next segment. Do you think you could be a pediatric nurse?
That's a great question. Prior to kids, I wouldn't even have to think about it. Not even a little bit. And it's funny you say that because I had like my CPR recertification today.
Okay.
And obviously one of the things they touch on is like CPR with kids and choking with kids and blah, 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 blah. Anyways, it was the first time I really like thought about my kids being in those situations, you know? And I was kind of just like, holy shit. For like a second, I caught myself kind of like, whoa, I went like down a dark hole of my kids going through that. And I was just like, holy shit. Like, I don't know if I could do it. I don't know. So now that I'm a dad, I would think about it. But ultimately, yeah, I want to get into peds.
Really? Okay.
I just love kids, truthfully. I mean, I wouldn't be giving them melatonin and all that shit. But I think now that I'm a dad, I would just think twice, you know? Mm-hmm. It just makes me think a little harder, that's all.
Yeah. For me, pediatrics, you gotta really have that mentality to be on a unit like that. And it's not because of the kids, it's more so for the parents.
Sure.
A lot of helicopter parents.
Sure.
Which I can't complain. I'd probably be the same way, but you have some parents that just take it to the extreme.
Sure.
And then also I've heard of situations where you have some parents that just aren't even involved at all.
Absolutely.
Like they're not there.
Absolutely.
Or they're there, but they're just not even in tuned or not even interacting with what's going on. Kids crying. Right. Yo, your child's crying. Are you gonna like help to soothe them down?
Right, you're still a parent, bro.
Right, because a mother's touch does wonders.
Right.
So I don't know. I think it's situations like that where I think my mouth, and especially in today's generation with nursing, the littlest thing that you say to a patient, that can get you fired quick. I've seen it where, and it's like, I feel like in a situation like that, I can advocate for a 7-year-old against, a parent and what she's doing wrong or what he's doing wrong. And I'll lose my job just because of that. Just because that's the parent.
Right.
So I think if I were to do peds, I'd probably get fired within 3 hours. I'm just being honest.
And I guess I could see that, but for me, I mean, being on a surgical unit, I think we just deal with family members so much, especially like elderly people's family. And a lot of the times they're a lot. Like they're on you. I don't know, man. You just shake it off,
Yeah.
I guess there's definitely that element of me, I guess, for lack of a better way of saying it, like judging parents for their lack of parenting. Honestly, I know this isn't very popular to say, but at least for me, this is where I just like would lean on my faith, being Christian, and I'd just be like, God, please hold me back before I beat this nigga's ass, bro. No, for real though, sometimes at work I just gotta like say a little prayer and I'm like, God, please help me right now.
Yeah.
I need your help right now.
No, for sure.
So it's no different with peds, man. I think it's different. It has different pros, different cons, but it's all the same.
And don't get me wrong, like I don't mind helicopter parents. There's levels to it, right? If you're a parent that wants to learn, okay, what's going on, and as a nurse, you should be explaining what you're doing step by step, not only to the child but to the parent, right?
Absolutely,
for sure, the parent. But you just have some. You can explain what you're doing, and that parent will be like, "Yeah, no, he doesn't like it that way." Well, what do you mean he doesn't like it that way? There's no ifs, ands, or buts. I'm the nurse. I'm the one that went to school. I'm the one that did the years, the struggles, the NCLEX, and you're telling me, and you're not even in the healthcare profession? Nah, it doesn't work that way. You know what I mean? So I think, like I said, there's levels to it, and that's an example of one thing that annoys me when it comes down to parents. Now, if you're a parent that's like, okay, what are you doing? Okay, is it gonna hurt? I'm fine with that, but don't tell me how to do my job. Absolutely. In a sense,
And you know what it is with family, at least for me, I go out of my way to over communicate with family.
100%.
So whether you're a parent, you're a son, daughter, niece, whatever, if you're the person's POA, I go out of my way. So if you're not there, I'll call you. I'll call you twice a shift. I don't care.
Yeah.
If I'm being told 1 hour this, another hour this, a third hour that, I'm going to call you 3 times. You know what I'm saying? So that you are not calling me with any type of attitude or coming up. You're aware of exactly what's going on with your family member. It'd be no different in peds for me. Like, I'm ready for these parents, bro. I'm ready. Like, bro, I stay ready, And again, I'm unserious. I'll laugh in your face.
Now, let me bring this scenario in. What if there's a parent? What about those kids that are? What about the kids that are the parents? If you know what I mean, the kids that run the parents.
Right.
Now you have a child who's sick, and they're just being defiant, and now you're looking at the parent to set the tone, and they're like, I guess if he doesn't want the IV, don't put in the IV. How would you respond to something like that?
No different than I would an adult patient that doesn't want the IV. Why are you here?
Facts.
No, for real. I've said that to patients. Like, if you're coming in for, you have I don't know. I don't know. It could be anything. You have cellulitis in your leg, and we got to give you IV antibiotics, and your IV falls out, and I got to start a new IV in your heart poke, and now you don't want us to poke you. Why are you here? Why are you wasting? You're wasting your time. You're wasting my time. Why are you here? So if a kid, he doesn't like that, like you said, I am the nurse. I went to school for this. A doctor's backing me. The hospital's backing me.
Exactly.
This is what you need. You don't want this. This is your only option. If there's other options, let's explore other options. If this is what you don't want, let's explore that. If this is your only option and your kid's setting the tone, go home. Here's the AMA. Have your kid sign it. You can sign it with them. Go home.
Big facts.
Bro, I don't play with these people, bro. If you don't want treatment and this is your only option. Again, if we have other options, we can explore other options. This is your only option, and your kid's setting the tone. Are you going to give him the keys to your house too?
Right. Keys to the
Is
Beamer.
he signing the mortgage?
Is she paying the bills?
You know
Or
what I'm
is he
saying?
paying bills?
So this is where I'm like, yo, I'm not putting my license at risk and not doing my job because your 7-year-old doesn't. AMA, sign right here, here, and here, sir.
and
go home.
and get the stepping.
Go home. This ain't a hotel, B.
I've seen it. I've seen it so many times, honestly, and it is just shocking to me that like a 7 or a 10 or a 15-year-old has that much power over a parent in a healthcare setting.
It's crazy to me. And it's, again, now that I'm a father and I know what it's like, and don't get me wrong, I know some of these kids are persistent, bro, I'm not the one or the two. I don't care if I'm your nurse or I'm your dad. I'm sign right here. Go home. Yo, Mo, my kid wants to play. Go to your room, bro. I'm not the one. Like,
For sure. But yeah, nevertheless, man, yeah, I don't think I could ever do peds. I've had some rough encounters with not just parents, but with certain kids.
yeah. Honestly, bro, this conversation made me excited, bro. I want it even more now. I can't wait to talk shit to these kids.
I remember, and this was in when I was doing travel nursing. It was my very first IV on the child, actually. I think the kid was like maybe 8 or 9.
Yeah.
Had an attitude. They didn't want the IV in.
Crazy.
To the point where all of us, we had to hold him down.
Yeah, which I've heard.
One nurse holds down the left leg, right leg, arm, and another nurse holds down the other arm that I'm going to start the IV in.
Yeah.
Mind you, we've already tried like 2 times. And this kid needs an IV for fluids.
Right.
Just isn't trying to drink or nothing. I get the IV in, boom, secure it. Everybody releases. This kid's free to move now. IV secured. What does this kid do?
Pull it out.
I'm like, yo, what are you doing?
Yo.
Like, I literally said that. I'm like, what are you doing? And everyone's like, Junior, relax. It's just a kid. I'm like, no. Like, what do you mean? This is my
little nigga.
Yeah, this is my first IV. What do you mean? Like this, we've been in here for an hour plus.
Yeah.
Bro, I just left. I said, no, I'm done. I'm done. Like, what do y'all want me to do?
Oh, that's funny as hell.
So I mean, after that incident,
What are you doing?
Literally, after that situation, I'm like, no, I can't do peds because
so funny.
they have the green light to do whatever they want, and
not with me, bro.
no, in a sense where like you can't even argue or like they're just a kid. Do they really know any better? You know what I mean? There's a 7,
100%, bro. I think kids are a lot smarter than we give them credit for.
They are, but at the same time, I mean, they're there because the kid's dehydrated. So who knows what's really going on in that noggin? But at that point, it's like, damn, come on.
Give that nigga some melatonin, bro. Put that nigga to sleep.
Put him to sleep.
That IV in, he'll be just fine.
Facts.
He'll be just fine, bro.
Facts. So I think for me, I can't do peds, man. Kudos to all the pediatric nurses out there. You know, the ones that be wearing the SpongeBob scrubs.
Oh,
and
hell yeah.
The Tweety Bird scrubs. I respect y'all, but I just couldn't do it.
Bro, honestly, I hate all of that, bro. I would do it for these kids, bro.
Yeah.
That shit's so much fun. Hell yeah.
Yeah, nah, I feel you though. I feel you. Yeah. There's a lot of perks to being a pediatric nurse, honestly. I know at the hospital they got like a slushy machine in there.
Oh, hell yeah.
Yeah.
We're worried about pizza, nigga. On nurses,
Yo,
they get
slushy machines. I'd be running it up. Mixing the blue with the green.
Oh, my goodness.
And getting, I don't know what comes together with that. Hell, I'll make yellow.
100%. Bro, I'm telling you, bro. Pediatric nurses got it good.
That's where it's at. But yeah, we'll wrap it up there, man. That's episode 5. And, appreciate y'all. Make sure you like, subscribe. Make sure you follow us on Instagram, Scrub Me In Podcast. We do have a Twitter, which I'm still working on. Facebook page is coming as well, too. There's so much, man. Subscribe, like on YouTube. I'm going to put out a link very soon. And yeah, I appreciate y'all and the support. We're going to be pushing out more episodes. And hopefully we'll get a guest on the podcast as well, too.
Hey, let's go.
All right. Peace.